So, Mileva, I hand it over to you now to begin with your questions for Dr. Fajgenbaum.
Wonderful, thank you. So, Dr. David, prior to the formation of the CDCN, I know we discussed a little bit about the diagnosis, but what was it like to be diagnosed with Castleman disease? Was it typically the norm to take over 6 months, or was it longer or shorter?
Yeah, it's a great question. It really depended on the subtype of Castleman disease that person may have and the severity of the disease. So some patients that had very severe Castleman disease that maybe put them in the hospital or the intensive care unit, they typically passed away within a few weeks if the diagnosis was not made that quickly. Whereas other patients that maybe didn't have quite as severe cases that didn't necessarily put them into the hospital, they may have had lingering symptoms for months and sometimes even years, which was obviously incredibly debilitating, incredibly frustrating. So things are changing, and there's progress that we can already see. And I get to see people like Gary, who was diagnosed much more quickly than I was, and of course, Mileva, you and I get to hear stories of patients daily that are getting diagnosed much more quickly than they typically used to be. So that's a really positive note. But of course, there's also patients where it still does take too long, and that's why you and me and others from the CDCN are putting the time we put into trying to raise awareness about these diagnostic criteria, treatment guidelines, and I'm really excited for us to be able to get out the unicentric Castleman disease guidelines this year.
Absolutely. One of the other questions is, one of the most amazing things that I see from our organization are patients and their loved ones wanting to join in the fight. What are some of the ways that our patients can join and do their part to help us find a cure?
Yeah, it's really incredible. I mean, as you know all too well, Mileva, we wouldn't be able to make any progress if any one of the pieces of the CDCN was taken out. So if physicians weren't part of the CDCN, if researchers weren't, if patients weren't, and if loved ones were not involved, none of this progress would be possible. And so patients and loved ones play a critical role and a vital role in many ways. There's loved ones like you who contribute your time as a volunteer. There are Castleman's patients like Gary who contribute samples for research. We can't do research if we don't have samples to do the research on. There are many others who contribute in their ways, and so the best way that Castleman's patients can get involved is by contributing their personal medical data through our Accelerate registry, which is very easy to learn about and to enroll in if you're interested at cdcn.org/accelerate. Also contributing samples for research. If patients are currently experiencing symptoms, then we would love to be able to collect a blood sample so we can understand what's going on at a molecular level in the blood of Castleman's patients, so we can start to tease this thing out, figure out how it works. And lastly, contributing funds to Castleman disease research is another way, whether it's through bake sales or fundraisers, events that patients are putting on. Those three ways, data, samples, and funding, are completely instrumental for the progress that we've made so far and any more progress we want to make.
So next question is, you have formed this amazing organization which is comprised of doctors and researchers, volunteers, patients, and loved ones. What actually gave you that idea to start it like that?
You know, I think that when I first was looking at the ways that rare disease research is typically done, I noticed that there were a lot of what were called support organizations or patient support organizations and a lot of research institutions, and they were always completely separate. And I think that for some reason, sometimes there's maybe good reason to do that, but what I realized and what I thought was that there could be a lot of synergy if the same organization could be both supportive and also be an accelerator of research and treatments, and that you really need a patient perspective to do a really good job with research, and you really need researchers to do a really good job with patient support. And so it seemed like if we could get everyone together and we could make sure that everyone knew that they were each valued equivalently, that I thought that we could really make a lot of progress. And I should also mention Arthur Rubinstein, my mentor, really was fundamental in encouraging that sort of a collaborative model, because everything he's accomplished in his life has always been through getting all the right people together and making sure everyone feels heard.
Yeah, I couldn't agree more. I think what you've done with this organization is amazing, and it's very unique to see such a different perspective on trying to find a cure for a disease. Next thing is, being the mother of Katie, I have to say one of the things I always worry about are what her chances are. It's a scary thing to live in the world of the unknowns, as you know, and I know that this is a worry for many of our patients. What is the likelihood of reoccurrence and survival rate across all the subtypes of CD? Yeah,
that's the question that keeps me up at night, and the issue that I think about all the time for so many patients. It's really challenging today to be able to give appropriate and accurate numbers on the likelihood of recurrence and survival, mainly because there have been so many really important changes that have occurred over the last few years. So if you look at historical data and you look at a study that was published in 2012, this is pre-siltuximab, there was a quite high mortality rate in the first 5 years after diagnosis. So about a third of patients died within 5 years, and another 25% died within 10 years. And that's really striking, and that's quite high, even relative to blood cancers like myeloma. It's higher than myeloma and lymphomas. It's really quite high. The good challenge is that a lot of progress has been made, and so we have reason to be optimistic that some of these new drugs that have been developed and new drugs that are approved, like siltuximab, are having a difference and having an impact on those sort of scary survival rate numbers. At the same time, we know that there are patients like Gary and like myself that have relapsed on drugs that we thought we wouldn't relapse on, and so the good news is that there's been progress, and I think that the survival rates are better than they've ever been. The important news that we should all be aware of is that there's still a lot of work to be done, and the work that we're currently doing and the work that many people are contributing to will have a major impact on continuing to make all of our outlooks on the future a bit more optimistic.
That's wonderful. So obviously you know Katie's story just almost as well as I do. She was diagnosed just like you. You know, it's a very scary time, and it's something that I think really shook us and left us with a lot of fear and unknowns and not even knowing where to turn. And then when I found the organization, it was amazing to be able to come on and be able to participate and help and advocate for Katie and advocate for other patients and give all of us a voice to see this through it and you know, walk alongside you to try to find this cure. Final question for you is, what does it mean to you when you get to see these patients and loved ones contributing and helping this organization?
It means everything. It means everything to me. It's so special to me because I know how tough it is to battle Castleman disease as a patient, and I know how many demands all of us have on our time and what we do with our time, and I know that all of us have a bit more of a perspective on time and the importance of it than maybe others do. And so the fact that people like you and Gary's wife Stacy and others put their time and in some cases their literal blood towards Castleman's research just means so much, because as I said at the onset of this webinar, if it was just me working in a lab by myself, we would have made no progress, and we still would have made no progress. But it's because all of us have come together. It's because we're all contributing in the ways that we are, that we're able to make progress for all of us. And I know how tough Castleman's is, and I know the demands that are there, which makes it even more special when I hear that someone's taking time out of their busy day to put on a fundraising event, or to go out of their way to give a blood sample, or to make sure that a piece of their lymph node gets sent for research, or to support other patients like you do. It's just, it's incredible.
Thank you, Mileva. We'll have Gary, your questions now for Dr. Fajgenbaum.
Okay. Dr. Dave, as a CD patient and someone in contact with so many other patients, how do you and others live with and take care of your Castleman disease without letting it take over your life?
That's a great question. It's a great question. I think the most important thing in thinking about your personal Castleman disease is to be diligent, but to not let it take over your life. So being diligent meaning always make sure that you get your blood tests when you're supposed to, always make sure you get your scans done when you're supposed to, and make sure you do exactly the things that your doctors are asking for you. Make sure you're aware of your symptoms. Are you getting more tired than usual? But know and feel confident that you're doing everything in your power by doing those three things, so that you can feel confident doing everything else in your life that you want to do. So make sure that you do your lab tests, you do your scans, and you think about your disease or your symptoms, but that you don't let there be really much more mental energy that goes towards that, and that you can spend time with people you love, and to be able to go back to the things you care about, with being able to feel confident that you're doing exactly what you can be doing by tracking those things.
Right on. So given what you and I both know about the inspiring impact of visits from people in remission to people battling a flare, how can we as patients and caregivers ourselves give the attention and support to others who are just beginning their fight?
I think that it starts with people like Mileva that get on the phone to talk to patients and to loved ones of patients while they're in the hospital, being able to even just connect with them virtually or by telephone. But I think maybe the most powerful part, maybe the most powerful weekend of the year for me is when we all get together in person at our patient summit. Most patients that show up to the summit or that are able to travel are fairly healthy. They've turned the corner against their disease to be able to come to Philadelphia, but not everyone has. And I think that being able to hug people that you've emailed with and to like see them doing better. For me, every time I get to see you, Gary, it makes me so happy because, of course, I have so many images in my head of you when you were so sick and on a ventilator, and just physically being able to see you just makes me so happy.
Yeah, the summit is a wonderful occasion. It really turned things around for me, seeing myself as not the only person. Well, I mean, of course, I knew
exactly.
of you. But to be in a room with 60 other people who are in this fight is really important.
I agree.
So I'm curious what the life cycle of a research blood sample looks like, from the patient's vein through to processed information to the point where you and researchers can visualize and manipulate it to ask questions and draw inferences.
Oh, yeah, great question. So, you give blood samples, and so when we get your blood samples, those all get processed in our laboratory. Processing means that we pull out the white blood cells out of your blood. We get rid of all the red blood cells, which makes up about 99% of what you're providing us. We get rid of the red blood cells. We just hone in on the white blood cells, and we pull out the proteinaceous fluid, what's called serum or plasma, and we separately store that. So with every blood draw, we have a serum sample, a plasma sample, and then we have your white blood cells. And our focus recently has been particularly on those white blood cells. And white blood cells are your immune cells. And so what are they doing and how are they different when you're in a flare versus when you're in remission? And the way we probe that is through a technique called flow cytometry. We also do something called single-cell RNA sequencing, which is a brand new technology. It's only existed for a couple years. And when we run these samples through these various technologies or assays and the results that we get back from those, we have a team that performs really in-depth data analyses on the data that comes back. Because you can imagine that when you're putting through millions of cells through these techniques, you get back millions of data points. And trying to piece together, one person, one sample, millions of data points. How do you do that? And that really requires a significant amount of data analysis expertise, but also a significant amount of time. And so a sample that you give tomorrow, it could be processed that day, but the results from the really in-depth experiments we're doing may not be interpretable, at least in the context of other patient samples, for maybe even 6 months after that draw. So the life cycle is long.
Wow.
And the other thing is that it's not just processing, performing, analyzing, but it's also in the context of other patient samples. We feel more confident in something we find in your blood if we also find it in another patient that has a similar clinical presentation to you, because then that suggests to us that it's not just a secondary finding, or it's not just something that maybe is a result of the disease, but maybe it could be a driver. And so we always like to look at the context, or look at every sample in the context of other samples. And so, of course, acquiring other samples also takes time, which means that the timeline's a lot longer than I wish it would be. But of course, we have to be really careful with the findings we take from research.
Yeah. I noticed you didn't list the mother hen stage of the sample.
Sometimes you have to sit on blood samples when you transport them to keep them warm.
So my next question is, as a patient who's in remission on a drug known to be highly effective on HHV8 positive multicentric Castleman disease, I wonder if any known HHV8 research may be helpful to CD research and vice versa, or if there are similar symbioses or commonality between CD and lymphoma or myeloma research, since the specialists in those disorders are the most common to treat Castleman disease patients.
Oh, that's a great question. Yes, so we absolutely work very closely with researchers in all subtypes of Castleman disease, and importantly, as you said, in diseases that are kind of on the periphery, like myeloma and lymphoma. And we're partly lucky, as you said, that because our clinicians often treat myeloma and lymphoma, they are some true experts in those fields, which means that when we talk to them about Castleman's data, they can oftentimes think about it in the context of related diseases.
Yeah, I know Dr. Aldrich does a lot of work in particular with the HHV8, which was what made me wonder. So given that most Castleman disease treatments involve immunosuppressants and or immunomodulators, what can a patient do to keep their immune system strengthened or conditioned without counteracting the treatments that keep us from having flares?
I think the number one thing is trying to avoid people around you that you know are sick. Avoiding sick contacts is really important because Castleman's patients, their immune system has been weakened by the drug. I think, unfortunately, there really isn't enough data and enough information about alternative sort of things like vitamins and supplements that are known to quote-unquote boost the immune system. And I generally am a little concerned about anything that could boost a Castleman disease immune system, because really the problem with Castleman's is that our immune system is too boosted. So I think that what we need is additional research to understand if there are things that can be done that could safely quote-unquote boost the immune system without causing any sort of issues. But really, I think the most important thing is for all of us to avoid sick contacts, so that way that we aren't exposed to people that could potentially get us quite sick.
Thank you, Gary. Thank you, Gary, for the questions. Dr. Fajgenbaum, we have just around 2 or 3 minutes left, so I'll quickly go through a couple of listener questions. And then I have one question, too, before we wrap up for today. There are 2 questions that have come in regarding relapses. They want to know what are the long-term effects multiple relapses has on the body, and are there any preventive measures that can be taken to avoid these?
Yeah, so with every relapse, there's certainly the potential for organ dysfunction, and organ dysfunction that could be progressive or prolonged organ dysfunction. Fortunately, most patients with Castleman disease, Gary and myself included, can get very, very sick and then can return to a very, very healthy state. So unlike many diseases where if you get very bad kidney function or liver function, you will not get it back, in Castleman disease there is the prospect that you will have return to normal of organ dysfunction. But it is important to know that with every one of these assaults on our vital organs, there is the potential for long-term dysfunction. So as far as preventing that, I mean, the real key is to make sure you're doing your blood tests when you're supposed to, make sure you're getting your scans done, and that you're on top of your symptoms so that if you do have a relapse, your doctor can catch that early. And if you do have a relapse, let the CDCN know, let my Castleman's research program at Penn know, because we would love to be able to get a blood sample so that we can actually see what's changing with the relapse, and hopefully you turn around very quickly, you get better right away, and we can get another sample when you're better, and we can see what changed between when you were sick and when you were healthy.
Thank you, Doctor. The next question is, are there any lifestyle choices in terms of nutrition, activity, exercise, diet that can assist in preventing flare-ups? Or are there any holistic therapies that an individual with CD can benefit from?
I think that I would say any holistic solutions like multivitamins and exercise and eating well that anyone does for general health, separate from Castleman disease, I think is a really good idea if you have Castleman disease. But I don't think there's anything additional for someone who has Castleman disease where it's you should do this because you have Castleman disease, and will be more helpful for you than for anyone who generally wants to do something for their health. So all those things like exercise and eating well and taking multivitamins and things that you would take if you didn't have Castleman disease or that your spouse or a family member would take that doesn't have Castleman disease, I think all those are good. But there isn't anything that we've come across that indicates that based on the way we know the disease works, that we think would help to prevent a relapse of Castleman disease. Unfortunately, we need to understand what is occurring at a molecular level in order to be able to make recommendations like that. And for that, we need more samples and more research. And so hopefully, maybe if you guys ask me back on for another call in the future, I'll be able to tell you exactly what's happening in Castleman disease and exactly what sort of supplements may be helpful based on that knowledge. But unfortunately, we're not there just yet.
Thank you so much for that. One last question, Dr. Fajgenbaum. What is the future say for Castleman disease in terms of research, treatments, clinical trials? What can a patient or a family look towards?
So we're actually getting ready to launch a clinical trial just over the next couple months here at the University of Pennsylvania and also the University of Arkansas for Medical Sciences. It's actually of the drug that I'm on, sirolimus, an mTOR inhibitor, and based on the research that we've done, we believe that this drug may have benefit for a number of other Castleman disease patients. There actually are already a few that are benefiting from it. So this trial will test this drug in 14 to 24 patients between Little Rock and Philadelphia, and patients from all over the country can travel to either place to enroll into the clinical trial, and they'll be on drug for 1 year, and this will give us the potential to understand how well this drug works in a clinical setting and to see if maybe this is a drug that could help a lot of other patients.
Thank you. That's really exciting. So we have a clinical trial that's going to be recruiting soon. Dr. Fajgenbaum, I have to thank you for sharing your story and also for sharing with us the methods you use. So congratulations on the progress you have made for Castleman disease. You've got diagnostic criteria. We found additional markers coming up with collaborative. So we're very pleased to hear that you're in remission now for a sustained period, and hopefully this can be shared with other patients with Castleman disease. So thank you so very much for your time and for all the information that you've shared. Mileva and Gary, thank you so much for participating and bringing the patient's perspective into this discussion. We also thank the University of Pennsylvania and the audience. This talk will be available on CureTalks.com and CureTalks at Penn. Visit our website for details on upcoming talks. Dr. Fajgenbaum's book titled Chasing My Cure, A Doctor's Race to Hope into Action is currently available for pre-order on Amazon and will be in bookstores on September 10th. So we have something to follow up on this call. His book is going to be out. So thank you and have a great day, everyone. Thank you, everyone.